community, and thank you for joining us for this new episode of Cardiac Café. Today, we are going to be talking about remote monitoring, what it is, how it works, and why it matters. Our special guest today is Dr. Fred Kusumoto, cardiac electrophysiologist with the Mayo Clinic in Jacksonville, Florida. He is also a clinical content editor-in-chief and, of course, on our Four Hearts Worldwide Board of Directors and Medical Advisory Board. I'll introduce myself since I'm new to the Cardiac Cafe as well. My name is Laura DeLise. I am the executive director of Four Hearts Worldwide, the nonprofit organization, as you know, that runs Pacemaker Club and Cardiac Cafe. I want to thank you for being here today, Dr. Kusumoto, to speak with us. And we're excited to learn more about remote monitoring and what it means and why it's important. And with that, I'm going to turn it over to you to present, and we'll take some questions and answers at the end, and I'll turn it over to you. Thank you so much.
Laura, thank you so much. Really just a pleasure to be here and to be able to present to this group on such an important topic, this remote monitoring. I have no disclosures. In other words, I don't work with industry, whatever the case may be. My role is with Mayo Clinic, but also I do things for the American College of Cardiology and previously for Heart Rhythm Society, but none of the manufacturers. Well, I do have one disclosure. I am really old and I'm awfully slow. So just please bear with me. Next slide. So I really wanted to give a sense for the history of remote monitoring, right? And it's interesting to think about sort of the history of pacing really developed, as you can see in the 1950s. That gentleman that you see here is Paul Zoll, who really developed this external pacemaker. And you can see how sort of remote monitoring was. There was no remote monitoring. You just turn dials and things on this large machine to adjust sort of the device. And clearly this was something that was used just after surgery for those patients who had heart block or arrhythmia problems right after surgery. If you can go to the next slide here, this then shows that first implantable device. This was put together by Rune Elmquist. He's the fellow on the left, and Aka Senning was the surgeon who put this in, the gentleman on the right. You can see that sort of initial pacemaker, right? You can see that round shape. And for those of you who can think about that shape, it was actually a kiwi shoe polish can that was used as the form to make this epoxy piece. And you can see then these kind of goofy electronics, et cetera. But it really had no ability to have follow-up. Really thinking about following up and then adjusting these devices came in the early 1960s. There were a number of these devices that had these sort of places that you would kind of by X-ray poke a pin into it and sort of adjust it to then have the device have higher rates, slower rates, things like that. But obviously that was really difficult, then clearly not remote. If you go to the next slide now, in fact, you can now start thinking about sort of what happened with remote monitoring. There's began having this programmability and then monitoring these devices. And the first ones were through the telephone. So you would put the telephone receiver onto this device. You would sort of attach it to your skin, some electrodes, so that you could get an ECG both with and without a magnet. Next slide, please. But it was really in the early 2000s. So really think about that. That's only about 20, 25 years ago. This is something that, as we'll talk about, is essential for pacemaker and device follow-up, but really is only 20 years old. There was this, I want to emphasize that we've gone from what we call remote interrogation to remote monitoring. Let me explain the difference. That will be on the next slide here. You can see that, again, originally back in the 1980s, 1970s even, you had trans-telephonic. In the middle, you can see this inductive piece. So what happened then, this is remote interrogation, where you go to the pacemaker clinic, they put that little device over your pacemaker or your device, and then it sends it off. But then what was really critical over a couple of years was, in fact, this notion of doing something automatically. So in other words, instead of having to manually send something over and having this synchronous communication between you as the patient and the pacemaker clinic, in fact, now you could have this monitoring that was in fact done remotely. And during the question and answer period, we'll talk a little bit about how this aspect goes. But the idea is that your pacemaker talks via Bluetooth, wireless communication of some ilk, to a device. It could be a phone, could be a specialized device That then sends things up to the cloud, and from the cloud, in fact, goes then to your healthcare provider. And really, what's special about this is that it provides for automatic monitoring and particularly alerts. So if there is something wrong with the device, in fact, it can identify it early, notify then your healthcare provider earlier. And what I really think about it that's so important, it allows for input and interaction with all members of the healthcare team because a lot of these devices, we always think about the person who implants it, but now these devices monitor your heart failure, things like that. So you could have all of this information not just go to one provider, but to multiple providers, and then allow interaction, of course, between you as the patient and your multiple healthcare providers, thus providing a web of communication, which is so vital and important. And that was really shown here. If you see the usual telephonic piece here, you can see that from the red, the original piece, in fact, when you go to remote monitoring, there was about a 3-month earlier identification of problems and issues. And so that's really important. So instead of coming into the clinic every 3 months, right, and finding something there, or maybe even every year, suddenly there was more real-time availability to identify something wrong with your device. And I think that that is absolutely critical so that you could have this earlier identification. What if there was a failure to your device, let's say a day or two after your last interrogation? Well, you might not
Mhm.
have your next interrogation for the next 3 months. Well, in fact, you'd then gone 3 months essentially with this device that might have been suboptimally programmed or having an issue with it. So that's why this is an important document that was put out by Heart Rhythm Society in 2023, led by Aileen Farrick, who is an advanced practice professional who's been a leader in Heart Rhythm Society for years. And there is a class one indication for all patients with CIED. So that's the umbrella term for patients with pacemakers, defibrillators, and everything else. Remote monitoring, RM, is recommended as standard of care. Next slide. The way that we think about anything that we recommend in medicine, not just cardiology, is with this class one, class two, and class three designation. Class one means you really just do it. It's the right thing to do. There's lots of data to suggest that it's absolutely important. Class three, on the other hand, are things that don't do that at all. And then there's a huge area in the middle, 2A and 2B. The 2A is generally you should do it, and then 2B is maybe not, but you could do it, but think about it. So here's the point that remote monitoring, class one, do it for all patients. And so for those of you who are not getting remote monitoring, we'll talk again about this in the question and answer period. Really need to talk with your provider about why that's not being done and to ensure that you're having remote monitoring. So we want to do it, but why are some places not doing it or perhaps doing it suboptimally? We can talk about what that looks like for all the question and answer period. The problem is that there are lots of challenges, whether it be getting staff, training staff, or really then thinking about the last part here of trying to what the staff themselves are facing. When we think about the training of staff, just remember that those people who are following your devices, they have specialized training. They are really unique and special individuals. I know that in many cases, they're your primary contact with the healthcare system, and they're usually incredibly experienced nurses who have that additional training in thinking about devices. Next slide. So, not only do you need a specialized team, but you also need great communication, right? Between all of the team members, right? So between you and let's say the person who is sort of getting this remote monitoring piece, but also then amongst all of the healthcare providers in that your environment that you have. So for example, between the heart failure doctor with another nurse, a heart failure nurse with a doctor, et cetera, pharmacists for medications, things like that, so that there are a host of things that are important to ensure that when I think about systems and healthcare systems in some of my roles with Mayo Clinic, there really is the interaction and the communication amongst disparate sort of parts of medicine as opposed to being individual silos. And there's a lot of information. So here is one of the challenges. So these devices have a ton of information. And so there is so much information that is being sort of sent over Unfortunately, there can be a lot of alerts. And that's why a lot of the alerts are actually not anything that we want to, that you should get fired up about because they're just not that significant, et cetera. Because what all of these devices do when they look at alerts, they want to over report. But the problem is that there are unintended consequences with over reporting. You want to catch everything, right? But if you catch everything, sometimes there's just too much data, sometimes too much information, maybe information that would be provided to you as a patient, where all it's going to do is cause unnecessary anxiety because of all of that information. So all systems work hard to sort of balance that reporting and the use of that information. And then the big issue is financial and clinical incentive. And this is something that all of you can do as advocates who have devices, that in fact there are these financial constraints and barriers. So, for example, when a device has a malfunction, there's what we call a field advisory, where there's maybe some warning. Know that the healthcare systems don't get reimbursed for that. We have to develop a system, things like that, et cetera, to then try to address these issues that come up. My point is for you as the patient to really take your healthcare advocacy in your own hands, really thinking about having these devices and the importance of that by talking to your lawmakers, by supporting For Hearts, other groups who are really working on your behalf to, in fact, make sure that everyone gets the best care who have devices or who need devices. So, what are the take home messages, right? I've talked a lot and we'll have a great question and answer section here in just a little bit. Here's the three things that I want you to think about with remote monitoring. Number one, remote monitoring is super valuable. It gives your healthcare team more information earlier and in a timely fashion. And it really is now essential for best care. So all patients who have devices ought to have remote monitoring. And you should ask your healthcare provider if you're unsure whether or not you have remote monitoring, or as we'll talk about in the next section, whether or not, in fact, you have any questions about the remote monitoring, because it's absolutely critical to do. So with that, again, Laura, thank you very much for having me on this program. And for all of you who are watching, thank you very much. And it's really been an honor to present to your.
Thank you so much, Dr. Kusumoto. I think a lot of those points really hit home with me in terms of talking with patients and talking about, we get a lot of questions about technology. We get a lot of questions about what's happening in the future or happening now with devices, and remote monitoring obviously is one of the topics that came up, which is why we're doing this Cardiac Cafe. And I think, there's always that fine balance as we're learning, as we do these sessions and hear from our Pacemaker Club community. There's that fine balance of information and too much information. And I think that's, a really big key and something we'll address, as you said, in a few minutes with some questions and answers. But really important topic. I know it, and I'm sure from attending Heart Rhythm Society sessions and interacting with all of the industry out there, that there's a lot of monitoring happening, a lot of new technology being developed, and it'll just continue to be refined, as it has been in the last 20 years, which is amazing that how new this really is. So thank you for sharing that. And we'll circle back around in just a moment with some questions and answers. And thank you to the Pacemaker Club community. And we'll see you soon. We're back again. Laura DeLeese here with Dr. Fred Kusumoto to answer some questions about remote monitoring. And I think we'll just jump right in and start to ask these questions that have come to us that are common patient questions that we get in pacemaker clinics all the time. And Dr. Kusumoto can provide us the answers to these most common questions. And so the first one is, does the monitor automatically transmit reports to the clinic?
Yeah, so a great question. In fact, yes. So most of the devices that we monitor do transmit automatically to the clinic, as long as you, as the patient, are sort of near your transmitter. If you're going to use it, that's why you need to have that transmitter at your sort of bedside table. Or if you're using a phone, some of the devices have a phone app. Have your phone sort of open with the app ready, etc. Now, there are some subtle differences between different devices, etc. But this is absolutely a question that you should ask your provider about and really ensure that the information is getting there and more critically, getting acted upon in sort of a timely fashion.
Yeah, I think a good follow-up question to that is, does the office receive daily reports or is it intermittent? Is that dependent on your device and your settings, or is that dependent on just how the monitoring is set up?
Yeah, so actually, there are not daily summary reports. So that happens every sort of period of time, depending on what type of device that you have, whether it be, 90 days plus one for loops or 30 days plus one for loops or 90 days plus one for ICDs and pacemakers. But if there's an alert, if the device identifies something abnormal, that in fact then gets transmitted, but not a daily summary. So those or a monthly summary. Those summaries then are done, as I say, monthly for loops or every 3 months for other types of devices.
I think that you mentioned in the presentation earlier that sometimes the device produces alerts that may or may not be important for the patient, but is important for the doctor. And so I think you mentioned, in that answer that the alert is really what sets that information to be sent, if I'm understanding correctly,
You're
to
absolutely right. But and the other side of things is let's say I, as a patient, have some sort of issue. You can manually send something. So what
okay.
you need to do then at that point in time is notify your device clinic that you'd like to send a manual transmission because of whatever, and then kind of go from there. Let's say, for example, yeah, you're starting to feel a little bit more short of breath, et cetera. And some of
Mhm.
these devices are very, very sophisticated and can identify whether or not you're accumulating fluid, things like that. Now, obviously, you can weigh yourself too, but in fact, some of these devices can help us even more so. Is there anything going on? Or maybe you felt some palpitation, something
Mhm.
really unusual. Then, in fact, you can ask for a manual or to see if the device recorded something. Remember that the device will record stuff. It'll be set to record fast arrhythmias or perhaps slow if it's not a pacemaker or things like that, but generally sort of fast things. So I think that it's important to remember that you, as a patient, can actually initiate an interrogation and an evaluation of your device if you have a symptom that you're concerned about.
Yeah, very good point. I think that's important for the patients to know if they don't know that already. And you also mentioned in the first question that you need to be close to your transmitter. So, what is that? What does that look like? The alert or the interrogation, the incident won't be transmitted if you're not close to the transmitter. And you mentioned by your bedside table.
Yeah, exactly right. And it just needs to be relatively close, whether you're using a transmitter or your phone. Generally, 6 feet is kind of the number that people sort of use. Can it do it a little bit from farther apart, perhaps? But you really just want to ensure good communication between your device and the phone or your device and the transmitter.
So, a follow up to that, a question that we, I think, get in pacemaker clinics. What if you're on vacation? What if you're away from home and you maybe have one of those symptoms and your transmitter is not with you? Or do you take your transmitter? What are those kind of scenarios, and how do you then transmit or contact your office if you're feeling like something is going on?
Yeah, so that's one of the advantages of having a phone-based type of system, so that in fact we all kind of carry our phones with us everywhere. It seems like these days, so that's helpful. But if let's say it's a transmitter, in fact, you generally don't have to do it if it's just for a few days, kind of thing. But if you're going to be somewhere for a prolonged period of time, taking your transmitter is a reasonable thing, and everyone sort of varies with sort of how long away you should sort of carry the thing. Our pacemaker clinic, the recommendation generally is for 30 days. We in Florida have a lot of people who split their time between the north and the south because they want to get out of that Florida heat, during the summer and perhaps away from whatever cold area they are, during the winter. So if you're going to be away for a prolonged period of time, then in fact, and you're using your device uses a transmitter, clearly bring your transmitter.
So I think you already touched on this, but I'll ask it anyway. Is my provider monitoring my implant 24 hours a day? And if someone is not reading them 24 hours a day, why should you have it? Why should you be sending the transmissions?
Well, that's right. I mean, Again, it's one of those things where there is a balance. Most clinics, sort of available, sort of with staff who are trained with devices. Remember, we talked about how specialized people are. Usually, it's business hours, Monday through Friday
Right.
with sort of business hours. I mean, obviously, if there's any kind of real concern that you have, and just worried, one of the neat things that has evolved, at least over my 30 years of being a physician, is that in fact now all of the emergency rooms have some of these types of devices to, in fact, interrogate your device. If you're at all incredibly concerned, you can go in there and get something downloaded. And if it's something like that that is actually that concerning and worrisome, perhaps a more holistic evaluation at the emergency room is appropriate, right? Because it's not just about your device. But no, what happens is that the device is generally being monitored usually sort of during business hours.
I think that's a really good point. We talk about it on some of our other sessions and episodes. Is A, call 911 if there's an emergency, B, let your doctor know. And they can always go back and look at the transmissions and the reports and the alerts and all of that kind of thing. But I think it's important, and correct me if I'm wrong, but it's not, I am understanding that the monitoring is sort of a backup to your doctor and what you talk about with your doctor. If you are feeling these symptoms or something is going wrong, it alerts them. But obviously, communication between you and your doctor is still the key component of living well and monitoring your device and how it's performing for you.
Yeah, absolutely. I couldn't, you're spot on, Laura. I mean, there's no question that the device is one part of our health, right? And so it's really, again, as I mentioned earlier, thinking sort of holistically. The beauty, though, of the remote monitoring is that you can get something earlier as opposed to depending on sort of clinic visits, where you go to the doctor's office, et cetera, and then kind of go from there for anything that is really sort of significant where there's a malfunction with your device. Let's say the lead goes wrong or whatever the case may be. And I think that that's the important thing. And I love this because I call it reversing of the Nile when I teach. Right? Usually, as a patient, you've got to kind of go to the place every 3 months, right? To your healthcare provider, and they kind of tell you stuff about this. Here, your device, you are providing information to the provider, right? It's the opposite direction, so that in fact, it can get things can get done much faster and in a more timely fashion, and that's been just a great improvement in healthcare overall.
Wonderful. So, kind of a techie question. If I have the app on my phone, you mentioned before a lot of these remote monitoring systems are an app on your phone and you can take it with you and that kind of thing. Is it easy to, if you get a new phone, is it easy to move all of that information over to your new phone? Is there any issue with that disruption of service, or is it a pretty seamless process?
Yeah, all the manufacturers have made it very seamless, but you do have to contact them that you've changed your phone, and then they actually have a dedicated. All the manufacturers have this a dedicated person or persons who can then help you sort of with that transition. But it is absolutely critical, and we do seem to go through phones, things like that, a little bit more than just going to the app store and sort of downloading it.
Okay.
Really ensuring a couple of things, getting the app, talking with the manufacturer, making sure that there is communication in both directions. Because remember, the data from your device goes to the manufacturer's cloud, and then it has to go from the cloud to your healthcare provider or providers. Remember how I spoke about one of the beauties of this is that this information can be sent to all of the healthcare providers who really need this information about your cardiac health, which can be provided by the device. So making sure that all of those connections are intact and correct with your new phone is absolutely important.
Critical, it seems. Yeah.
Indeed.
Here's an important question. Does remote monitoring cost more to the patient, and how is it billed if it does have an additional cost, and how does that aspect work?
Yeah. So again, as I mentioned, the way that billing works, it's 30 days plus one for implantable cardiac monitors, these devices that don't pace or provide defibrillation, but are looking for any kinds of arrhythmias, or 90 days plus one for defibrillators and pacemakers. You know, From my point, remote monitoring is so valuable and so important, but it doesn't replace an in-person visit, which I think needs to be done once a year, sort of at a minimum, to then really talk about any sort of issues. Of course, now, obviously, sooner if something comes up that you're concerned about and worried about. But remember, the people who staff these device clinics are all incredibly experienced. They're usually an experienced nurse who, in fact, also has this additional expertise. So they have a lot of insight into just making sure that you're doing well. And there are obviously many times people that you see on an annual basis or more frequently, and for that reason, I think valuable. But by having the remote monitoring, allows it to be much more convenient for you so that not only can you do it earlier, but sometimes some things I'm doing great. Thank you very much. I don't need to necessarily go to the office, the type of thing. But getting that information to make sure that the device is functioning well every few months, every 3 months is critical.
You actually answered my next question, which was, how often should you go to the office? And so that is, a minimum of once a year, depending on your situation and as needed, otherwise determined by you and your healthcare provider. So I'll move on to the next one. Curiosity question, I think is can I access the report that my remote monitor is sending to the clinic and
Yeah.
look at it and see what it says?
Yeah, absolutely. So this has actually been a point of contention sort of previously, and it is also something that has some variability. So at our place, our patients have access to it. We just provide it. But remember that the data that you have will first go to the manufacturer's cloud, and then from the cloud down to sort of us with regards to your care. The manufacturers, not inappropriately, have been concerned about access to cloud information, right? Because maybe then that would allow for possible hacking, things like that, proprietary data, whatever the case may be. But generally, for your individual data, your individual information, just about every clinic that I know of will freely and happily give you that information to you. But to get it specifically from the manufacturers I mentioned, there have been sort of points of contention, but I hope everyone understands that there are reasons for that. It's not that they're trying to hide something, but it really is thinking about protecting everyone's information on the cloud.
That makes sense. That makes sense. I think one last question that I have is what if I live in an area that does not have good cell service?
Yeah, that's a great question. In fact, the manufacturers are understand this and will provide you, let's say, with some wired system, whether it be Ethernet, whatever the case may be, to allow for that, because they all acknowledge the importance of remote monitoring. So I absolutely understand that sometimes cell service is just not available in certain places. But if you just contact the manufacturer, they are aware of this and actually have solutions to, in fact, take care of this.
And just as a follow up to that, because the question that just popped into my head is
Re-
I'm assuming that the healthcare provider will guide you to the manufacturer and who at the manufacturer and how to contact them. It's not something that the patient has to research on their own.
Heavens no. So again, talk with your healthcare provider. They're going to have all the information with regards to your device, the intricacies. And remember, these are all, made by humans. And so there are issues that can kind of come up with these field advisories that I mentioned earlier. So really, your first place of connection should be with your healthcare provider.
Right, yes. Is there anything else that you would like to add about remote monitoring? Any patient questions that you get on a regular basis or important aspects that we haven't covered yet?
No, we've covered most of it. I just mentioned it sort of earlier in my discussion. Really ensure that you are getting remote monitoring because I think that that is valuable. And really being an advocate for allowing remote monitoring to kind of continue and et cetera, for with whatever resources that you might have as an individual patient, et cetera, because it really is a community, right? I mean, that's why we have the Pacemaker Club. It's a community of people who have devices that interaction with their healthcare providers, the whole healthcare system, and really making sure that this works together as seamlessly as possible is so important.
Awesome. Yeah, I think communication, everything comes down to communication, communication, communication.
Indeed.
Yep. Well, thank you so much once again for joining us on the Cardiac Cafe. I think this has been a really interesting topic. I actually learned quite a bit myself. So I'm always learning, and I appreciate all of the knowledge and input that I've gathered over the course of this programming, as well as through the Pacemaker Club community itself. Thank you, Dr. Kusumoto, so much. With that, we will close out remote monitoring. Thank you to the Pacemaker Club community. And as always, feel free to reach out to us with suggested topics, questions you may have, and we will do our best to get those answered for you. And maybe schedule an episode about your topic of concern. Thank you so much, and talk to you next time.